Hi, my name is Grismel, and this is the chapter 24. Infections. A. Fever. A medical student has made some language notes on a case report. Case 45. A 24 years old man presented with a fever which he had had for 3 days. On the third day, he had had a severe attack of fever with sweating and rigors. The only past history of prevalence was hepatitis 4 years earlier and glandular fever, infection with Epstein-Barr virus at the age of 18 years. He had returned from Africa 3 weeks previously. Fever. Pyrexia. Also remember PUO. Pyrexia of unknown origin. Fever also known as temperature. I've got a temperature. Adjectives. Feverish, febrile, and peripheral and peripheral. Opposites. A febrile, a perexial. Some symptoms of fever: sweating, rigors, severe shivering, and sensations of coldness, also known as chills. B. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms, such as viruses of bacteria. They can usually be indefinite, thus establish the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive of antibiotic, and most infections are potentially curable. Unlike many non-infectious degenerative and chronic disease. Communicatively is another factor which differentiates infections from a non-infectious disease. Transmissions of pathologic organs to other people, directly or indirectly, may lead to outbreak or epidemic. Finally, many infections are prevented by hygienic measures, by vaccines, especially live-attenuated vaccines such as rubella vaccines, or by drop prophylaxis. For example, Sholnokai to prevent malaria. Microorganisms include bacteria, viruses, fungi, protozoas, such as the parasite that cause malaria. Another general word for these pathogens is microbes. Patients often refer to microbes as germs or bugs. Notice the common expression for accident and infection disease. Could he have caught some disease from the dog? Could he have picked up some disease from the dog? I think I've caught the flu, but that's going round. C. Storage and spread of infections. Here is an extract from a medical textbook. Infections may originate from the patient's endogenous, usually from skin, nasopharynx of bowel or from outside sources, exogenous. Often another person who may be either suffering from an infection or carrying a pathogenic microorganisms. Carriers are usually healthy and may harbor the organisms in the throat, for example, diphtheria, bowel, salmonella, or blood hepatitis B or HIV. Non-human sources and infections include water, E.G. cholera, milk, A.G. tuberculosis, food, A.G. botulism, animals, E.G. rabies, bears, A.G. pathocys, and also the soil, A.G. legionnaires disease. The incubation period is the period between the invasions of the tissues by pathogens and the appearance of clinical features of infections. The period of infectivity is the time that the patient is infectious to others. Now I read the chapter 24 in Spanish. 24. Infecciones. Fiebre. Un estudiante de medicina ha hecho algunas notas del lenguaje de un informe de caso. Caso 45. Un hombre de 24 años se presentó con fiebre que había tenido durante 3 días. Al tercer día había tenido un fuerte ataque de fiebre con sudores y escalofríos. Los únicos antecedentes de relevancia fueron hepatitis 4 años antes y fiebre glandular, infección por virus de Epstein-Barr a los 18 años. Había regresado de África 3 semanas antes. Fiebre perexta. Recordar también PUO, perexia de origen desconocido. Fiebre también conocida como temperatura. Tengo temperatura. Adjetivos fibril y perexal. Opuestos fibril a perexial. Algunos síntomas de fiebre, sudoración, escalofríos, temblores intensos y sensación de frío, también conocidos como escalofríos. Infecciones por microorganismos. Defienden de otras enfermedades a varios aspectos. Lo que es más importante son causadas por microorganismos vivos como virus o bacterias que generalmente pueden identificarse, lo que establece la etiología en una etapa temprana de la enfermedad. Muchos de estos organismos, incluidas todas las bacterias, son sensibles a los antibióticos y mayoría de las infecciones son potencialmente curables, a diferencia de muchas enfermedades degenerativas y crónicas o infecciosas. La transmisibilidad es otro factor de diferencia. Las infecciones de las no infecciosas. Enfermedades. La transmisión de organismos patógenos a otras personas directa o indirectamente pueden provocar un brote o una epidemia. Finalmente, muchas infecciones se pueden prevenir con medidas higiénicas, con vacunas, especialmente vacunas vivas atenuadas como la vacuna contra la rubiola, o por profilaxis farmacológica, por ejemplo, cloroquina para prevenir la malaria. Los microorganismos incluyen bacterias, virus, hongos, protozoos como el parásito que causa la malaria. Otra palabra general para estos patógenos son microbios. Los pacientes a menudo se refieren a los microbios como gérmenes o insectos. Nota las expresiones comunes para adquirir una enfermedad infecciosa. Podría haberlo tenido, podría haberlo hecho, podía podía haberlo recogido alguna enfermedad del perro. Creo que me he contagiado del gusanillo de la gripe que anda dando vueltas. Fuente y propagación de la infección. Aquí un extracto de un libro de texto médico. La infección puede originarse en el paciente endógena, generalmente en la piel, en la nasofaringe o el intestino, o fuentes externas, exógenas. A menudo otra persona que puede estar sufriendo una infección o ser portadora de un microorganismo patógeno. Los portadores suelen estar sanos y pueden albergar al organismo de la garganta. En la garganta, por ejemplo, la difteria, el intestino salmonella, la sangre hepatitis B o VIH. Las fuentes de infección no humanas incluyen el agua, ejemplo cólera, la leche, ejemplo tuberculosis, los alimentos, ejemplo botulismo, los animales, ejemplo rabia, las aves, ejemplo psittacosis, y también el suelo, ejemplo legionela, enfermedad del legionario. El periodo de incubación es el periodo entre la invasión de los tejidos por patógenos y la aparición de las características clínicas de la infección. El periodo de infectividad es el tiempo en el que el paciente es infeccioso para los demás. Now I read the exercise. 24.1. Match the two parts of sentence. Look at A, B, and C opposite to help you. 1. 1988 saw the UK launch of life attenuate with J. Measles, mumps, and rubella, MMR vaccine. 2. Chickenpox, varicella is a common infectious with E, a disease of childhood. 3. Rabies has an incubation with A, period ranging from 4 days to many months. 4. The patients remain febrile with age, with spikes of temperature of 39.5. 5. He was admitted with a 4-day history of influenza-type symptoms of fever with B. 3 years malaria and general malaise. 6. Quite a proportion of patients who have recovered from hepatitis B with C become carriers of the virus. 7. The central part of Africa is in the midst of an epidemic with F of AIDS. 8. Males rubella is most with D infections during a catarrhal stage. 9. Lyme disease is caused by transmission with G of B. Birth from animal to man by exotics. And 10. PUO stands for E, pyrexia of unknown origin. 24.2. Complete the case report on the patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examinations, he looked unwell. His pulse rate as 100 minutes he had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period usually 10 to 14 days. In case the patient admitted he had not been taking purifers regularly, the diagnosis was confirmed by presence of parasites in his blood film. 24.3. Complete the sentence. Look at A, B, and C opposite to help you. 1. An infection which can be treated successfully with antibiotics is curable. 2. Another word for epidemic is outbreak. 3. Bacteria and viruses are examples for microorganisms. 4. Someone whose temperature is normal, a febrile. 5. The common infection being Epstein-Barr virus is not a glandular fever.